Hi there, Dr. Sarah here from Balance Within Physical Therapy. I wanted to talk about today why a more holistic and full body approach to physical therapy is really important for postpartum patients. And I use postpartum loosely because whether it's a few months or years or even decades postpartum, these are the imbalances I see pop up in most women's bodies because of the delivery process and third trimester and positioning and just physical changes that happen. So we're not great at this in the United States. Countries like France and Germany and others have women do physical therapy after every childbirth. Often they're focusing on the pelvic floor, which is awesome and so important. And there's also more to it than that. I got into this from my background in sports medicine and orthopedics, where I would work with so many women in their 40s, 50s, 60s, and beyond that could trace their problems back to this postpartum period where they felt like they never got their core strength back. Their posture always felt funky. They always seemed hunched forward. They never felt as strong in their balance afterwards. And so all of these things are things that really need to be looked at big picture wise and addressed to prevent problems down the road. So here are some of the changes, and it's actually pretty easy to address these, and usually it takes 5-10 sessions of therapy or so, and sometimes quicker. Every woman has kind of a different combination of these imbalances happening, some more than others. But the good news is we get you back to normal, we set you up for success the rest of your life and prevent all sorts of spine and joint problems and joint replacements and all that down the road. So can't recommend taking care of yourselves enough in whatever time frame you get to it. So pelvic floor, this is your pelvic floor. Got all 3 holes here, right? This gets stretched quite a bit. It's one of our main supports or hammocks for our organs, for our viscera. It controls our pee, poop, and sexual functions, pretty important things for our quality of life. These are muscles too. They get too tight, they get too weak, they're not strong enough, they don't have good endurance. And if these aren't functioning properly, we can get all sorts of symptoms. So super important to address this. We also have our abdominals. Of course, these get stretched out in our 3rd trimester to make room for a baby. In some women, they feel like they can get their normal core strength back pretty quickly. I'd say in many, many women, they're feeling like something's off and it isn't functioning or firing properly. Really, really important to have good core strength to support our back, and even with our upper body too. If our core isn't strong, we can't be strong through our arms and shoulders, and we'll tend to shrug when we're lifting, which causes a lot of neck tension and whatnot. During 3rd trimester, our bodies get into a position where our pelvis is actually tipped forward to make room for a baby. And it's really common for women to get stuck in that position with the abdominals turned off, the back overworking, and just having this hinge point in our low back and irritation. So getting us back to a neutral position, loosening things up here, waking up the core and balancing things out is so great for preventing problems down the road. With that extra curve in the low back, then we curve back the other way in the 3rd trimester. Then, of course, whether you're bottle feeding or breastfeeding, we're here. We just get so hunched forward, and that causes so much stress and strain back here, and then tightness in the front of our neck and our chest and our diaphragm. If we don't address that, then we end up with headaches and jaw problems and tension and shoulder problems, neck problems, like you name it. So all of this is, again, so easy to address and so helpful, so important. I love working with moms, again, whether it's a few months or years or decades later, getting all of this into a normal alignment, normal function, normal support, getting that strength and stability back. Women just always tell me how they feel like they have less stress and tension, and they're surprised to find they have more energy and their bodies just feel better, they're up for life. It is so helpful. So we have some really great guides on postpartum physical therapy on our website you can check out at pt.com. We do also offer free consultations if you'd like to schedule a discovery visit. We have a limited number available each month where you can pick our brains and we can help you get to the bottom of any sort of postpartum pelvic floor ache or pain thing that's going on. We are happy to be a resource just so you can know what options are available to you. I hope that helps. Reach out with questions. I know that was a lot of information. Have a great day.